Hi there, Dr. Steve with Kinesi, and here we are with our Wiggle of the Week, part 3 for the ankle joint. We started with localized mobility in the first video where we really targeted the motion at the joint. Then in the second video, we integrated that movement into a more global body motion. We did some lunges, and remember we're always doing all 3 planes of motion, forward and back, side to side, and we rotate. Well, this time we're going to integrate that ankle motion even further, and we're going to wiggle it into the whole body doing a balance reach. But we're going to pick that same pattern that we did with the lunges and use that for the balance reach. So you're going to be balancing on one leg. The other toes are going to start where you're reaching forward and back, and you're balancing, but you're just lightly tapping the toes. After some forward and back, you're going to go side to side in the frontal plane, and then we're also going to rotate in the transverse plane. So you first start with the toe taps. If you can progress to not toe tapping and just going through the motions, reaching as far as you can, but you want to make sure that the whole body is moving. You don't want to just be super rigid and stiff. You want to have the whole body moving, but where you can control it safely. Now you might be saying, okay, I can't balance like that. I can't be on one foot. There's lots of ways to work with that. Use as much stability as you need to make you safe. You still want to challenge yourself, but hang on to something sturdy, and you can do the same thing. You toe tap, and then when you're ready to not toe tap, you just hover the foot. And you can go in all directions and still have a lot of stability. If that's more than you need, you can go with a couple of sticks and then go through the same motions, forward and back in the sagittal plane, side to side in the frontal plane, and rotation in the transverse plane. Maybe you're getting better and you don't need 2 sticks. Just 1 stick will do. And then again, balancing, hitting all the directions, doing the toe taps. And when you're progressing enough, then you get to without hanging on to anything. And all joints, but the ankle in particular, foot and ankle is embedded with all these little wonderful nerve endings. Those are the switches that turn on more muscles. So when we're balancing, we're getting the most information up into the nervous system to help you turn on more muscles and to help you balance and be safe and not fall over. Remember, this month is the foot and ankle special, so if you or anybody you care about has a foot and ankle issue holding them back, bring them into Kinesi and let us do a free assessment on their foot and ankle issue and be able to figure out a plan of attack. And next month we're going to have a different body part, but be on the lookout next week for our wrap up and review of the foot and ankle. Hope to see you next time.